I'm going to expose a topic that is Zika infection complications. And my name is Henry Santiago Alarza Massa. I'm studying from the Universidad Católica Santiago de Guayaquil, and this presentation is for my medical English class, and my doctor is John Moscoso. So, to start with this presentation, we must start with the definition about Zika virus, what it is. So, Zika virus is an emerging arthropod-borne virus. It's in the genus Flavivirus that caused a widespread outbreak of febrile illness and is associated with neurological disease and had spread across the Pacific to the Americas in a short period. And it spreads by mosquito vectors of Aedes genus.
Zika virus is a flavivirus. It's an infection that's carried by mosquitoes, and it causes an illness that's usually very mild. It can even be asymptomatic. One of the reasons that the Zika virus is of so much concern lately is not from the infection itself, but of the late consequences, particularly in pregnant women. So this has caused the largest degree of concern. Congenital abnormalities that have been linked to infection of pregnant women with the Zika virus, and that have later effects on the fetus. In terms of a vaccine, we don't have a vaccine for this disease either, but there are several candidate vaccines that are in research stages right now, and we're hopeful that perhaps within a year or so we'll have with vaccines to prevent this disease. So at Johns Hopkins Medicine, we are well positioned to address many aspects of infectious disease threat like the Zika virus. For instance, at the Bloomberg School of Public Health, we have many researchers who are doing vaccine development research on similar diseases like dengue. These efforts could be repurposed to develop vaccines for Zika virus infection to prevent the infection. From a patient care perspective, we also have infrastructure in place to screen our patients for recent travel. So I think when facing any infectious disease threat like the Zika virus, it's important to remain calm and to arm ourselves with the facts. And the Centers for Disease Control and Prevention is an excellent resource to get information and to stay abreast of the current advisories and recommendations.
So now, continuing with the presentation, we're going to talk about application in medicine. In this section, I included 3 topics that are symptoms, epidemiology, treatment, and prevention. Starting with symptoms, we have headache, fever, myalgia, arthralgia, neurological disease, Guillain-Barré syndrome, and microcephaly in fetus. Then, continuing with epidemiology, we have this information. It was first identified in Uganda monkeys. It's transmitted by mosquito vector Aedes genus. More than 4 million infections in South America, and 8 out of 10 patients are asymptomatic. Now, continuing with treatment and prevention, there is not a specific antiviral drug for Zika virus, and we must relieve symptoms with rest, fluids, and medication. There's not even a vaccine in the market, and we must not be exposed to mosquito virus. This is a prevention measure that we should take to avoid the infection of Zika virus. Now we're going to talk about pros and cons. And starting with pros, I include that once you get infected, you get the Zika antibodies. Another thing is that some of these infections are more asymptomatic than symptomatic.
Not everyone will get symptoms. It's pretty common. Viruses like this that many people who are infected don't ever show any symptoms. So it is important for people, if they have potentially been exposed, to take precautions, especially.
And the cons are that there is a lot of exposure in tropical weather countries. It has a widespread range. The symptoms can complicate neurological disease, and it can even cause microcephaly in pregnancy.
Zika virus can be transmitted through mosquito bites or sexual contact. Infected babies may suffer from microcephaly, affecting their growth and intellectual ability and requiring lifelong care. The virus can also cause neurological complications, such as paralysis or respiratory difficulties. Death may occur in severe cases. Everyone should take precautions to protect themselves from getting Zika virus.
Now, continuing with the presentation, we are not going to talk about this virus in our country. So the MSP recommends that we should control the proliferation of the mosquito Aedes aegypti, and we permanently eliminate cans, jars, containers where rainwater accumulates, and we permanently remove stagnant water from puddles, pots, baths, and tires. And we must brush well tanks and any container containing useful water. And we report a suspicious case to health units in a timely manner, and use mosquito nets and fine mesh on doors and windows. So, to finish with this presentation, my conclusion about this virus is that the Zika virus is a virus that is spread by mosquito vectors in Aedes genus, and is a virus that caused large epidemic in South America. And this virus normal symptoms include headache, fever, myalgias, but the complications on this infection can produce neurological disease as a Guillain-Barré syndrome and a microcephaly during pregnancy. And we must be aware because there is not a vaccine for this virus right now, and we must avoid exposure to the vectors. So that's it. Thank you.